Hi everyone, if you loved the orofacial release video part 1 on YouTube, then you'll appreciate this little clinical pearl or tidbit. The point I'd like to make is that a lateral costal, which is, think of this as an umbrella breath, okay? Think of your rib cage as an umbrella so that when you breathe, that's why I call it umbrella breathing, without any tension here, that's what orofacial release is for, part 1, right? Without any tension here, with 0 chest rise. I want you to be able to inflate your lungs and move the rib cage out to the side on an inhale without flaring this way. So I don't want you to feel that the rib cage flares up, out. That way, I want you to feel like it only expands this way, or that's what I would say if I was working with a patient, right? So that is an umbrella flare, but not really umbrella, flaring this way. And the reason is this, is because there are lots of teachers that have learned to teach articulation, to teach vocal techniques, but what happens is they're not really watching ribcage movement. And those breathing techniques can end up inadvertently teaching or not monitoring your rib flare. Okay, when you're at rest, that angle is going to be at about 90 degrees, right? And as I inhale and I get the rib expansion that I want, it goes to here. When I let it go, it comes back again. Sometimes you'll see this angle not change and you'll just get lots of flare out this way. Or what if the rib cage is already flattened because they're really, if they throat clear and you push your belly out, then everything is constantly kind of, I call it dumping, okay? Everything is kind of dumping out this way, but you're never really allowing for this, particularly rib cage expansion here. See how I can expand in the back and release? Expand in the back and release. And I don't. See how I don't get anterior flare? I don't get front flare. So the real question is, can you actually flare your back ribs like a fish gills breathing, right? And get that umbrella expansion out to the side. So can you umbrella breathe and can you fish gill breathe? This is true whether or not you have a pelvic floor problem like leakage, pelvic pain, or other dysfunction, male, female, all genders. Or if you are an instrumentalist, woodwinds, brass, for example, or you are a singer, then all of these things are going to apply for you. So you really want to work on those advanced breathing techniques. I hope this has been helpful. If it has, please give it a subscribe, share it with your friends. Look in the description on how to sign up for the waitlist and my newsletter, because the newsletter is a compilation of everything that I'm doing on a weekly basis, so you don't have to go to 6 or 7 different platforms. You just get the one email. All right, thanks for listening.